welcome back to my channel. It's Dr. Margaret Lott from Amon the Wellness Center. And in today's video, I'm going to go over the 5 most common labs ordered in the primary care setting and why they are important to have done this year. CBC. The CBC stands for your complete blood count. It looks at your white blood cells, hemoglobin, and platelets. Your white blood cells are important markers of your immune system. When the level is high or low, it can indicate that there's some type of infection or disease process occurring in the body. The hemoglobin is what we use to determine anemia. If the hemoglobin is low, then that may indicate anemia is present in the body. Anemia can present with symptoms such as fatigue, weakness, and hair loss. When the hemoglobin is high, that may indicate dehydration. Platelets. Your platelets are important for your body's ability to control bleeding. If your platelets are low, your body may have a difficult time stopping a bleed, and it may present with heavy periods. If your platelets are high, then that may indicate there's some type of inflammation, autoimmune, or infectious process occurring in the body. CMP. The CMP stands for Comprehensive Metabolic Panel. The CMP looks at your electrolytes, such as your sodium, chloride, potassium, and bicarb level. It looks at your calcium and protein levels. It lets us know your blood sugar, and it also looks at your kidney and liver function. Hemoglobin A1C. Your hemoglobin A1C gives us an idea of how your blood sugar has trended over the prior 3 months. This is helpful because in the CMP, we get an idea of what your blood sugar is at one specific point in time. So if it's early in the morning and you haven't eaten, your blood sugar can be low. If it's in the evening and you've had a nice big meal, your blood sugar can be high. But with the hemoglobin A1C, we know what your average blood sugar has been over the past 3 months. This test can let us know if you have prediabetes and you're at risk for progressing to diabetes, or if you have diabetes and how well controlled your condition is. Lipid panel. The lipid panel looks at your total cholesterol, bad cholesterol, good cholesterol, and triglyceride levels. This test is very important because when your cholesterol levels are high, it increases your risk for heart disease and stroke. And if your triglyceride levels are very high, it can increase your risk for pancreatitis. So by being aware of what your levels are, you can make the appropriate diet and lifestyle changes to reduce your risk for these conditions. Vitamin D. Vitamin D is an important test because many people are low in vitamin D and they're not aware of it, especially in areas of the country where there is not a lot of sunshine for prolonged periods of the year. And even here in Florida where we get plenty of sunshine, but most of us spend our days indoors. And studies show that by having adequate levels of vitamin D, you have an improvement in mood, sleep, bone health, and immune system function. And low vitamin D is very easy to correct with vitamin supplementation. Those are the 5 most common lab tests that are ordered in the primary care setting. And I like to have these tests done at least once a year on myself so that I have an idea of how my health is and if there's any positive changes I can make to improve my health. If you have insurance, these tests are usually covered by your insurance company. If you don't have insurance and you live in the state of Florida, we are able to get patients this entire panel for under $30 due to our partnership with DPC Alliance. If you're interested in having these tests done, you can visit our website, amonthewellnesscenter.com. The link is in the description box below. That's it for today's video. If you enjoyed this topic and you would like me to go into detail on any of the labs above, please leave a comment. If you found value in this information, please like and subscribe. Thank you so much again for watching, and remember to eat well, live well, and be well.
Subscribe to YouTube.